Yeah. Baido, you can start.
Okay. So shall we start now?
Yes, ma'am.
Yes,
Okay.
ma'am.
Yeah. Hello everyone. Good evening and welcome to Naboy Classroom. We are very lucky to have with us our national faculty who will be an expert of this session. She is Dr. Rashmi Nair, and we have our own Devika Borua. She is the speaker of this session, and Dr. Gautam Khaun will be the moderator. Uh, I hope during this session many participants will join because the subject is very interesting, and I'm sure that Deepika will make it some light to this very interesting subject, and it will be a very fruitful and a very interesting subject. So now I would request Dr. Anjan kindly introduce our today's expert faculty, Dr. Rasmi Nair.
Good evening, ma'am. Good evening to all. So it's my honor to introduce Dr. Rasmi M. Nair, an eminent consultant, laryngologist renowned for her expertise in voice, airway, and swallowing disorder. Dr. Nair completed her MBBS, MS, ENT in ENT and DLO and DNB ENT from Government Medical College, Tirubhadandapuram, followed by a fellowship in phonosurgery under Dr. R. Joykumar. With over 14 years of clinical experience, she has earned recognition for her excellence in both medical and minimally invasive surgical management of laryngeal conditions. She is the founder of Madhavan Laryngology Clinic, Kosi, and is currently associated with Estar Medicity and Renai Medicity. Her area of special interest includes professional voice care, phonosurgery, voice feminization surgery, and dysphagia management. Dr. Nair has several publications in national and international journals, uh, served as a reviewer for the laryngoscope, and is a regular faculty at various state and national conferences. She is the recipient of the Best Outgoing Postgraduate Award and is Rising Star Award at Phonocon 2013 and presently serves as the president of Kerala Association of Phonosurgeons of India. Dr. Rasmi, her commitment to clinical excellence, research, and education continues to make a significant contribution to the field of laryngology. So we are privileged today to have her with us. So I welcome Dr. Rasmi Nair for her as an expert for today's classroom, and we hope that her insight to this subject will enlighten us, every one of us. So welcome, Dr. Nair.
Thank you. Thanks a lot. Thanks for this opportunity too.
Yes, I'm very happy to introduce today's speaker, Dr. Devika Borua, who was once my student at Guwahati Medical College while doing her postgraduate. Dr. Devika Borua is senior ENT consultant, presently working at the Nightingale Hospital and Pratiksha Hospital of Guwahati. She was trained under Dr. J.K. Menon in laryngology. She is the first to start Botox clinic and office procedure of laryngeal surgery for spasmodic dysphonia in Northeast. She was the organizing secretary of 19th Annual Conference of Phonocon in 2024 at Guwahati. She is the secretary of Dhani, a society of health workers. She has several publications in Index Journal of Otorhinolaryngology. This is very brief biodata of Dr. Devika Borua. Now I would like to request I must introduce our moderator, Dr. Gautam Khaun. I think who doesn't need any introduction in Northeast and also in India uh, among our members of otorhinolaryngologist and head and neck surgeon. A very humble and a my dear person, Dr. Gautam Khan, did his postgraduate from Guwahati Medical College. Presently, he is the chief consultant at Nightingale Hospital, Guwahati, and also head of the Department of ENT at Koras Pratiksha Hospital, and visiting consultant at Apollo International Hospital. He is highly experienced in otology, phonosurgery, rhinology, and cochlear implantation. He was the past president of Indian Academy of Otorhinolaryngology and Head and Neck Surgeons, vice president of Association of Phonosurgeons of India, and also fellow of Indian Academy of Otolaryngology and Head and Neck Surgeons. With this brief introduction, I invite Dr. Devika Burwa, who is the speaker of the session, to deliver her presentation. Her topic is management of vocal nodule. Over to Dr. Devika Burwa.
Thank you, ma'am. Thank you so much for the kind introduction. I'll just share my screen. Everybody, can you see my screen?
Yes.
you are.
Okay, so today we are discussing a very common occurrence in our profession of when we see voice patients, that is vocal nodules. So we are going to discuss about the management of vocal nodule. So first, let me introduce what is a vocal nodule. It's one of the commonest benign laryngeal lesion, organic lesion. It's usually bilateral, and it's mid-membranous, and it's fairly symmetrical. So this is why I am stressing it, because many a times people just write nodule. In some cases, just look at these pictures. They have one picture, we have a cyst in the vocal fold. Other also there is a intracaudal cyst that causing a trauma on the opposite cord. So these two are not the vocal nodule. So anything in a vocal fold, it cannot be named as nodule. Nodules are always bilateral. And to know about the etiology, these are fibrotic masses. They are with fibronectin deposits located superficially in the vocal fold, and it occurs in the lamina propria of the vocal fold, and it causes a basement membrane injury also, and there is thick layer of collagen bands, and it also causes basement membrane reduplication. And the hallmark we see when we do the examination is the hourglass that I'll come on later on. So main thing is it's a phonotraumatic lesion. So why it happens in that strategic location of anterior 1/3 and the posterior 2/3. Actually, posterior 1/3 is the cartilaginous part of the vocal fold. That's not a vibratory surface. So it exactly happens at the midpoint of the membranous vocal fold that has the maximum contact during the phonation. So that when the people have more of a shouting voice or abuse, then we have that point of contact. So it's in the mid part. So it happens in children also. Bimodal age presentation 3 to 5, 8 to 10. After 13, and in adults, it's more common in females than males. So while looking through the preparing this lecture, I went through this article, found this article. This is very recent, done in 2021. They have seen more expression of Ki67, EGFR, and also increased expression of IL-1 alpha. They were trying to study the markers associated with the proliferation and hyperplastic changes that goes on inside the vocal fold during the nodule formation. Maybe in future we'll find some cure depending on these researches. And they have significantly find there is no change in morphology of the vocal nodule from 17 to 56 years of age group. So again, the most commonest cause is the vocal abuse. Vocal abuse means when you use your voice more than necessary. You shout at the top of your voice, And when you do not know what is your ability, what is your capability of shouting, and misuse is whenever it's not needed, then only you are using at the top of your voice, you are speaking like this. Even a housewife does not know how much she's shouting over her child, or a person who's doing business, how much he is using the phone, how much voice he was using. So that also leads to more voice use. Genetical predisposition, some studies say that there is more deposition, more presence of more fibronectin fibers in some people that might lead to more problem, more development of the vocal nodule. Allergens, people having more of a runny nose, allergic rhinitis, nasal infection, they constantly have a post-nasal drip. So that leads to constant throat clearing, like that irritation in the throat. That might contribute to the formation of the vocal nodule. So same other factors like laryngopharyngeal reflux or chronic cough, that leads to the more use of voice, so that will cause more formation of vocal nodule. And even in children, one study has found there is association of muscle tension dysphonia and LPR. So management depends on the evaluation of the patient, then proceeding for the treatment. So in evaluation, every evaluation starts with the history of the patient, and then clinical assessment. We listen to the voice, we check the maximum phonation time, then voice handicap index, and GRBS scale is for mostly prognostic finding and how much difficulty the patient is having in their day-to-day life. That denoted by these factors. So this is just a voice handicap index, just to show you how the patient can fill it up to know their severity of their symptoms. So this is also GRBS scale. The examiner can grade the according to how rough is the voice, is it breathy, is there is too much weakness, or how much strain is there. So you can score it accordingly. Higher the score, higher is the difficulty. So these are some of the voices when the person visits our clinic. The, listen to the first voice.
ছমাহমান হ'ল কিন্তু মই এনেকৈ মানে কথা পাতি থাকিলোঁ কাৰণে মোৰ মাতটো বেছিকৈ ভাঙি গ'ল আৰু 1 2 3
কৈ যাওকচোন 1 2 কিমান দেৰি পায়
1 2 3 4 5 6 7 8 9 10
ই So maximum phonation time, it should be 6 to 8 seconds minimum, maybe 10 seconds also in healthy individuals, but hers is it's less than 5 seconds. So she is a businesswoman. So she is describing how she is talking to people when she does business, then her voice is gone back. So this is another, she is a gym
7,
instructor.
8, 9, 10, 11, 12, 13, 14, 15,
Slight huskiness
16,
is there,
17.
not much, but still she's having trouble.
Say your work, please. Could come correct.
Oh, okay. Sorry. Ganeshguri Gold Gym Ganeshguri.
So another
और गुस्सा होता है तो ऐसा फोर्स करके बोलना पड़ता है आवाज़ भी ऐसा धीमी हो जाता है
She is also saying when she is angry,
थक जाता
then
है
she
दिन
can
भर काम
when she
करके
speaks,
रात
then the
को
voice
वो
breaks.
भी शाम को भी
Until the evening time, voice vocal fatigue sets in. So that is the significance of vocal nodule. Vocal fatigue we see in most of the patients, and this is one of the singer who's trying to sing. Otherwise, she is fine in the talking voice, but whenever she tries to sing, there is speech break. So next we go for the clinical assessment of the patient. Then we see by stroboscopy. So we see the mid-membranous vocal folds. I've just muted the sound for talking. So this, you can see the mucosal wave freely travels on the other parts of the vocal fold, but at the vocal nodule it stops, and there is a non-vibratory portion at the site of the nodules. But the other portion, and there are some different level of keratosis, different sizes of the vocal nodule. This is a soft nodule, but this is more prominent. And this has a early nodule, but still there are some keratosis going on over the hyperplastic fringes of the vocal fold. We can see that. So we can just think about the treatment strategies, how much longer this will take when we assess the patient. So coming to the treatment part, the most important thing is for the treatment thing is our goal is to improve the quality of the voice of the patient. Sometimes what happens, even if there is a slight small nodule also, the patient may not come to you for a change of voice. Then we don't treat that patient because the patient is satisfied with that voice. But if the patient is complaining about that voice, then only we should treat it. Counseling and explanation of the disease is number one part of the treatment, because this is a recurrent lesion. Unless and until the person does not change the habits or lifestyle changes leading to this disease, the problem will not go away. So following vocal hygiene is one of the most important points that we teach the patient. Voice rest, avoid shouting, good hydration, increase the intake of water. There should be enough lubrication in the throat when they speak. There should be avoidance of habitual throat clearing. Throat lozenges actually they cause more dryness. People think that it's soothing, you'll feel good when we speak, but instead it causes more dryness and it does not help. Balanced diet will prevent your reflux, acidity, and acidic drinks, and either this Coca-Cola or something like that, that will cause more acidity. Avoiding excessive tea or coffee without having food throughout the day, that is commonest among the teachers, because this is more commonly seen in singers and teachers. So they usually do that. Adequate sleep routine is also important for to remove the fatigue, because voice is like it's part of the body. So if you're not at rest, then your voice is weak, and when it is weak, then you start to strain. So that will also lead to more strain and leading to formation of the vocal nodule. Then avoid talking over background noise, avoid smoking, avoid whispering. Whispering leads to more of the false phonation. So that leads to more problem. It does not help with the vocal nodule. And for singers to warm up and cool down their voice before singing, and avoid singing with nasal or throat ailments, and also for allergic people to avoid fumes. And most important is most of the people do gargling for the nodule. Any voice change, they go for the gargling thing. Everything is pharyngitis or tonsillitis, but that will worsen the problem. That will not effectively treat the problem. So in children, what we do to reduce the strain, it's a behavioral management actually. For children, forceful whispering and coughing, that should be we should make them understand, because most of the children it gets cured by puberty. A small percentage only progress beyond puberty, because the growth happens and the vocal fold elongates and the nodule goes away. But still some people some children need therapy for that, because of the middle avoid shouting, because nowadays they are encouraged to sing something or say something in the class, too much of a projects going on, so that needs to be understood. And everybody wants to be a singer during their even the children, they want them to be good singers, and they whether they are practicing in good scales and or not, that also should be kept in mind. So voice therapy is the most important treatment. It's an effective treatment to improve the quality of voice. So sometimes even though the lesions do not completely resolve, the voice quality improves with the phonatory exercises. So it's a sustained vowel phonation that leads to phonation in the adducted position of the vocal folds, and that causes compression of the vocal fold. That is the primary exercise. Also increasing breath power is advised to do long breathing exercise, because lung is the powerhouse of the voice. So that also leads to so better voice outcomes. And treatment of the associated conditions, so we'll see that. So follow-up is essential. So this is one of the Manipuri lady we are talking
मेरे
about.
गले में थोड़ा बोलने से तकलीफ है, पर अभी थोड़ा ठीक हो रही हूँ।
She is much better with the therapy.
पहले से बेहतर है।
Okay.
So she is the gym instructor now.
1, 2,
Her voice
3,
is
4,
prominent.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14. I'm a gym instructor. My voice is better. 1.
So there's special mention of the singers because it's a singer's nodule. So look at this person. Start.
Sa re ga ma pa dha ni sa sa re ga.
See, she is a recurring patient. That means sometimes she is well, but again she comes back. To look at her face posture also when we assess, because her mouth opening is so small. Even if she is speaking in the singing in the high pitch voice, her mouth opening is not proper. So that leads to strain in the neck. So in the vocal fold position, look at how she is singing. She has early nodules. She is not able to attain the higher pitches. So even if she is going for the higher notes, her the larynx's anterior posterior compression is properly seen. So she low pitch or high pitch, it does not matter. She is using a wrong technique to sing the song. So we need to correct that position, not only treating the nodules, but technical correction should be there so that we can correct her problem, so that it does not happen. So these are the some of the associated factors. Muscle tension dysphonia is most commonly associated with the vocal fold nodules. So this is type 2 muscle tension dysphonia, where there is a compression of the lateral portion, that is the false fold, and there are association of the anterior posterior compression also, that is type 3, and if there is a squinting of the larynx, that is type 3 or type 4, you can say that. So when treating the vocal nodule, this muscle tension dysphonia should also be addressed. The number one thing when we see the patient with vocal nodule, if you just put your fingers, two fingers in the neck, at the between the hyoid and the thyroid superior cornu, just press like that. Sometimes the patient will wince in pain. So that is the thing, that the muscle tension dysphonia is causing the pain along with the vocal nodule. So whether when we correct the for the vocal nodule treatment, we should always think about the muscle tension, and we should correct that along with it. So because the voice is bad, they are straining too much to make it clear. So that leads to secondary muscle tension dysphonia. Sometimes primary muscle tension dysphonia also leads to the vocal nodule. LPR is also very common factor that is related to the vocal fold nodules. This is the interretinal pachydermia can be seen in these patients. That is very prominent. They won't tell you at first. They will tell you only about the change of the voice. But when we ask repeated questions or when we give them leading questions, they will tell about the reflux issues. So whenever there is a reflux issue, there is constant sticky sensation in the throat. They will constantly clear their throat. So that also leads to the formation of the vocal nodules. And many people, we do find that they have psychological issues also. It depends on their personality, like how they are speaking, when they are speaking, undue strain when they are talking to, what tone they are. So that needs to be also addressed. So now the question comes, if do you need surgery for the vocal nodules? So any type of vocal nodule, even if it's a fibrotic one, it takes 6 to 12 weeks to disappear, it is said. But I have never done a surgery for the vocal nodules. Nodules rarely do not respond to non-surgical. This is from the book of Satlock. So there also Cochrane also reviewed that there is inconclusive in comparative effective treatment of vocal, since it's a recurring lesion. So if even if you do the surgery, if the habit correction is not there, vocal hygiene and therapy is not done, then it will come back. So surgeries are discouraged. So so there is another point I wanted to mention. Sometimes we see cyst like this. This is actually not a nodule. It looks like, I got it from a picture. Sorry, I lost a video, so that's it's not looking good. So this this is actually the cyst. This here is the cyst, and this is hitting on the other cord. This causes the edema. So the edema caused by it looks like an edema. But on follow up, we see this fold as with anti-inflammatory treatment management, this fall has become normal, but cyst is still there, so that needed to be operated. So in those cases, we need the operation to differentiate between the cyst and the nodule. So definitely this was not a nodule. So if we are confused like this, when we see a fusiform swelling like this, we should always call the patient for a repeat scopy after a course of anti-inflammatory medication. So Satloff has described the surgery for this, the nodules, which are hard nodules, which are not relieved by the therapy alone. So this just to clip the focal nodules at the base, not to strip the mucosa, just because it's in the lamina propria only. Just a cup with the cup forceps, it's cut like that. So I just want to conclude my lecture is that diagnosis with follow-up is very important, and proper diagnosis is also important, as I highlighted. And counseling the patient about vocal hygiene and lifestyle modification is one of the important part. Surgery is the last resort, and we should do the voice therapy properly and also keep on checking the patient. Even if the patient is on voice therapy, we should call the patient for checkups intermittently, maybe 2-3 weeks follow-up should be done. Follow-up scopy should be done, because otherwise sometimes patients do not continue it, slight recovery, then they will leave the therapy and they go back to the same routine and they have the same complaints. So thank you so much.
Thank you, Dr. Devika, for your presentation. And now over to Dr. Rashmi for your input into the subject.
It was a wonderful presentation, Deepika. You have covered everything in a nutshell, that too very crisp and clear. One thing I would like to add is for the pediatric cases, they won't sit for the therapy as such.
Yeah.
So maybe something like a balloon blowing or candle blowing would help to improve the breath power, because for children, usually they would have a poor breath support, and that would be the reason for the nodule. So maybe we can add that too. We can
Yes.
instruct parents to do that too, so that it can be improved.
Okay, thank
Just
you.
everything, it has been covered well.
Yeah. Sir, want to add something?
Dr. Gautam Khan?
No, thank you, Devika, for your presentation. I think we'll move on to the questions that are there in the chat box.
Yes.
I mean, the first question, obviously, from Pugan sir. He wants to know about the composition of fibronectin. Does it have any diagnostic value?
Maybe diagnostic value it's not there, but it's there in the lamina propria, so it hypertrophies, and there is actually cell death, apoptosis, regeneration, ischemia. All that process leads to the layering of the epithelium. So that leads to collagen deposition and all. It's all the process of inflammation actually.
Yeah, fibronectin basically is an extracellular matrix protein.
Yes.
So which helps in tissue repair. That is, Dr. Reshmi, would you like to add something on that?
No, sir, nothing, nothing more than that.
Dr. Phukan sir has also an interesting question for Devika. How, I mean, the late Jubin Garg maintained his humming voice. So how did he maintain his
Yeah,
voice?
that is actually I am feeling sad for Zubin for one part, because I always give example of his singing to other singers who come to me, because they talk so much, they talk so loudly, they shout, but Zubin Garg never speaks in a higher tone. He always speaks like this whenever he's in a mic or like this. But when he sings in that tone. So I say, see, how he is using his voice. He's taking voice rest. He's preserving his voice so that he can sing at it. And that's one is God's gift. Number two is his practice, how you sing, how you are trained. And with practice only, people can achieve that voice.
Dr. Reshmi, you can pitch any comment that you might have. Swagata ma'am wants to know about who is at risk for vocal nodules.
Yeah, whoever has an increased voice demand would have it. Especially for some, it would be like usually they would have a one-to-one conversation, and later on they go for as part of their profession, they go for a increased voice projection. Then they are prone to for the vocal nodule. There are certain precipitating factors, triggers for it. Sometimes when you have a respiratory infection, when you have a reflux event, after that you have a soreness of the throat, and because of that your technique changes, and that would be the reason for the nodule too. So usually the voice users, those who have an increased voice demand, especially a increase in voice projection is required, they would be prone for the vocal nodule too.
Is stress or anxiety related things maybe has some influence in vocal nodule form?
Yes, definitely.
Yes, ma'am. I mentioned psychological causes also in some people. They did how they are using their voice, they don't know. Whenever you ask them, like, no, I don't shout, I don't talk so loudly. But they use their tone in a different way in some situations. How they are speaking, they do not know about it. So for that only counseling is needed.
And one more thing
Yeah.
is they would have an increased muscle tension. Most of the muscles
Yeah.
would be tensed, and extrinsic muscles of the larynx would also be tense. So that would be the reason for that chances of vocal nodule or voice strain in those who those who have an anxiety or stress factors.
Okay, thank you.
Right. Dr. Mukul Patar wants to know that can you please explain the reason for vocal fatigue in vocal nodule patients, as there is no involvement of any neuromuscular structure of the larynx?
No, actually, the vibratory surface is compromised because of the nodule. So the proper vocal fold whole length is not there. So the voice is bad, and the same time the person is trying to speak normally, trying too much. Then that also leads to the vocal fatigue. At the end of the day, the voice is tired actually. Vocal fold, you are constantly, and your breath support is also led because there is a phonatory gap because of the nodule. So that leads to the fatigue, I think so. Dr. Reshmi, you want to add anything anymore?
It's something like we'll give it as an example. You want to blow through a straw, and you are partly closing it and doing it. The
Yes.
bubbling, the bubble that you get would be much less. And we understand that the bubble is less, but we don't understand the reason for it, that it's being compressed, and that's why the bubble is so small. So what we tend to do is we'll push and do it so that we'll get a bigger bubble, but still our effort
We're
is
tired. More
we get
effort.
tired, but the result may not be that great. So it's something similar to that. You have a tension over here, you are not understanding it. You are pushing your voice, you understand that your voice has an issue, but doesn't understand where exactly the problem is. So we are pushing it too much, and that causes the fatigue too.
Thank you. Arpita Mohanty has a query. Ma'am, can you recommend books to know more about vocal hygiene and vocal therapy, voice therapy?
Yeah, you can for here you can buy Dr. Jayakumar sir's book is there. He has written very nicely about voice therapy and vocal hygiene also. It's an Indian book. You can DM me. I can send you the name and how to contact, and you can get it easily.
Right. So, Dr. Phukan sir also wants to know that why do you have nodules more in adults? Why do you have it more in females? Is it related to any hormonal changes?
That actually I have not found it. Why? Maybe females talk more or something like that.
Don't say
We
so,
talk more.
Devika. It's
Maybe.
because the frequency of for the
Fancy.
female, it's a
Yeah,
bit it's higher. So the number of times the vocal cord would be hitting would be double that of a male. So that would be
might be.
one
Yeah.
of the reasons for why it's more
Yeah.
common.
Dr. Mohan wants to know how to manage a hard or mature nodule.
So even a hard and mature nodule will reduce with therapy if it is done continuously, 6 to 12 weeks. But even after that, the nodule persists, then you can think about surgery. But I do not know, but because I have never done a surgery for the nodule, So people usually recover because our goal is to get a good voice. Even if a tiny nodule stays there, also if the voice is good, if the person understands if causes of the nodule, then that goes away.
Right. Swagata, Swagata ma'am wants to know, can GRD be an associated factor for vocal nodule formation?
Might be, because if there is a severe reflux and all LPR, as I said, the person does not take any measures for it. Maybe constant throat clearing and coughing with that might also lead to the nodules.
Right. Anjana Sharma wants to ask you about, sorry, it went, just a minute. Yeah, Anjana Sharma wants to know, can you, what is your suggestion on voice issue in group training session?
Group training means?
Anjana, can you specify?
Yeah,
Yeah.
whatever, every student, their range is different because their structures are different. Male structures are different, female structures are different. But most of the music school, we have seen that they are trained together, and so that is creating a lot of problem. Like if your scale is low, you are but you are singing in a higher scale, definitely you are going to develop injury to your vocal cord. So similar situation might be facing because you are running a voice cleaning. Though, how you suggest to your
Yeah,
student?
actually, teachers, the music teachers should understand the capability of the students. Even if they are taking too many students, in general, they can teach them, but individually, they should be looked after. If seriously they are thinking about training their students, so small groups are better. Many classical singer teachers also come with their problem. They also say they have to sing with the students also and how they are. So actually, everybody's scale is different. So when we start out, they do not actually say that you have to sing in that scale or like that. It should be comfortable for everyone. But sometimes in a group thing, it's difficult to judge actually, see also. But they should.
I think Reshmi can come up with some
Yeah.
good ideas because
Hello.
because
Hello.
as somebody is talking on the phone. Can you kindly switch it off?
Okay.
না বন্ধ হয়ে যাবো চিন্তা না করি
Okay, I will
বন্ধ
do
হয়ে যাবো
that. I will do
that
that.
is Mukherjee sir as usual.
Yes.
So, Dr. Reshmi, because we have seen in when children undergo training for classical music or whatever, the scale of the child keeps on changing with age, especially more so in the males.
Yes.
So I think it becomes a very pertinent point for the teachers to also realize that the child's scale is also changing with his growth, etc.
So the one of the suggestions would be for children and ladies, the pitch would be almost similar. So maybe in the group session, you can combine it for children and female, and male pitch is a bit different. So that group should be combined together. That would be a better option for Dr. Anjana's question that is on group training. And as you said, sir, for the male, when the pitch changes, mainly the singer has to be aware of that because their scale completely changes, but their range will not change. They can go for the lower scale much better. So the range will not change. So if they try to go for their previous scale, that would cause a strain. So they should understand that there would be a pitch drop. There would be a change in their scale when they go to the adolescent age. That would be, they should be aware of it. The teachers should be aware of it. Only then we can change it.
We need vigilant teachers, the bottom
Yeah,
line.
the teachers
Dr.
should be aware
Devika,
of that.
Devika, there's one query from Dr. Anjan Jyoti Bhuya. Is there any other risks beside voice change if not treated?
No, I don't think so. There is no change. But nowadays there is one terminology has come up. Sometimes nodule may develop a polyp over it because of continuous strain. So the people have coined the term podule on that, polyp over a nodule. So that might change. So polyp will need surgery again, like that.
Okay.
Otherwise,
In the,
that will not turn into a nothing malignant or something like that. Nothing will happen. Voice will keep on worsening, and muscle tension will also develop because the person will keep on straining the voice.
right. There's one query from Anjana regarding the scale. She says, how do you suggest a bass scale for a singer? Because most of the music teachers do not have scientific knowledge on that.
Yeah, actually, the is actually Anjana Baido is more trained in classical. She will know better than me. The scale actually is determined by when they learn the singing process. When there is a training, gradually they go up in our ragas. But the amateur singers actually they do not do that. They directly go just copy a song and they try to sing it. So that becomes more difficult. But gradual learning process, gradual elevation of the scales, whatever they want to achieve, and the person who is learning, they should be more conscious that this is, I am comfortable in this range. I can speak, I can sing all the notes if I sing in this scale. So that should be that person's range. That is what I feel from my experience with the patients that I have come across. Many of the singers, new singers are trying. There are too many shows now. There are so many singers, young girls and boys. They just want to copy someone, just to want to sing that song. I say that you sing that song, but what is your scale? Don't go for that particular singer's scale, because that is not same. The scale of two different famous singers are not same at all. That is
Yeah.
what I
There's,
make them understand.
there's one query from your next room. What is the investigation of choice? Rigid, flexible scope or strobe from Biswajit Gogoi?
Rigid scopy is opticals are better with the rigid, but sometimes when you ask the singer evaluation, then the flexible is better because the tongue is free, then you can evaluate better.
And to
So,
differentiate between a vocal
Yeah,
nodule and a cyst,
yeah,
stroboscopy would
strobe
help.
is good. Yeah, and also sometimes early nodules are easily picked up by the strobe. Sometimes we
Strobe.
miss it in the laryngoscopy.
And to
right.
answer Dr. Anjana's question on the scale, the best pitch, the speaking pitch, what they have would be the base scale for them and have to develop from that. Usually a singer should have at least 1.5 to 2 octaves, minimum of 2 octaves. So slowly they can develop on that. So, and identify the comfortable pitch for a comfortable range for the singer. Slowly while practicing, we need to have it. So the base pitch should be usually the speaking voice itself. Some of the singers may go in for a totally different falsetto voice alone when they sing. So their range would be constricted then. So they have to identify that this has to be combined with the falsetto range, not the falsetto alone. That would constrict the range tremendously.
Right.
Thank you.
Yeah. There's a query from Dr. Bidhan Das. How will you manage pediatric patient with vocal nodules?
That is what I said. It's actually
Yeah.
counseling of the parents mostly. So to
Yeah.
encourage them not to shout, why the child is shouting so much, why the
And I think
screaming, that can be
and
controlled. In
yeah,
school
and
also,
Dr. Rashmi has also told us
yeah.
about how to. So Dr. Phukan sir wants to know about voice. Why do you have voice changes during menstruation?
It's because the hormonal changes, there is edema of the vocal folds, then that leads to speech drop and the voice changes.
Dr. Anjan Bhaiya wants to know when to use steroid.
Steroid.
Mhm.
In case of nodules, so you do not use steroids. Suppose there is a hemorrhage in the vocal fold, even if the patient is having nodules, sometimes sudden shouting will lead to hemorrhage along with the nodules, over the nodules. Nodule is a chronic thing, not an acute one. So when there is a vocal fold hemorrhage with that, then or if there is too much congestion, then you can use a steroid.
Right. There is a comment, I think younger male children have increased incidence of vocal nodule than female. I don't know. Then
I also don't know.
Biswajit Gugate has commented that auditory feedback and vocal fold nodule, any correlation, particularly for professionals?
Yeah, auditory feedback is necessary for all the professional people because they will have to listen to their own voice when they perform. Otherwise, they will not recognize at what pitch they are singing, what range they are going. So that is important so that they do not shout, if you mean that by that. Or
We
if
have
Dr.
come
Rishmi
almost to
can
the
say.
end of the questions if none is forthcoming. But I was expecting one question which has not been asked by people. If vocal polyps and vocal nodules are both due to phonotrauma, why should we have vocal polyps in some people and vocal nodules in some? I thought somebody would ask that question. I think Devika, you'll be. Could you please explain to the audience why that should happen because both are
Yeah,
vocal trauma,
it is actually written
phonotrauma.
in a book that I have read that extrovert people have the nodules and the introvert actually those suddenly they shout they only have the polyps.
Reshmi, my understanding is that the sudden burst of, I
Yeah,
mean,
sudden.
it will cause more of
Polyp.
hemorrhagic polyps, but when it is a continuous sort of, am I correct?
Yes, it's a nodule is something like a callosity due to constant friction between the two surfaces, and the other one it's because of a sudden abrupt increased loudness or due to sneezing or coughing, especially those on medication, antiplatelets, all have injury of the blood vessel, and that causes the polyp. Exactly
Right.
what you said.
Dr. Reshmi, you have been dealing with singers for a very long time now, more than a decade. So, and you are one of the few, again, people who are totally into laryngology. So, can you give tips for the audience regarding how to deal when a established singer comes to you and you find that there's a nodule in the vocal fold? How do you go about it? I
Yeah.
mean, for a novice, for a child who is learning to sing, you can tell them everything. But when a professional, established person comes to your clinic, how do you deal with that person?
Yeah, it depends on just an incidental finding of a nodule. They don't have to get scared, but singers are too much apprehensive. They are too scared of the nodule. They think that it's something so scary. Actually, the nodule is just a callosity. We can see most of the singers may have it even incidental as an incidental finding because of the constant increased voice demand. So what we need to know is what exactly was the reason they had come for. And sometimes it may be a totally different issue. Like it's not a voice strain at all. They just have a voice fatigue or they have a throat discomfort when they go for continuous singing. So it depends on what exactly their problem is. So a proper history taking and evaluation is the important key there. And most of the singers usually, especially those high profile person, would come with an acute issue. Sometimes they would have a show, upcoming show, and just few days before that, they have a voice change or something. So it could be probably some acute issue like a hemorrhage or an edema due to the continuous use. So we have to have a proper evaluation. If there is a hemorrhage or edema, our advice should be to take a voice test, but that may not be a practical option for the singer, but the final decision should be by them. If they can avoid it, they should definitely go for it. And if not, they should find some other alternative techniques. That is, they have an upcoming program, they don't want to cancel the show. So what they can do is, it's something like call a friend. They can ask someone who is into the singing too, and they can sing a song, take few breaks, and then do it. And for such cases, there was a question on steroid. For such cases, steroids would definitely help, but a word of caution should be given about the problems of the steroid too. And most of the singers, what they face is during the stage show, the vocal hygiene part, most of them are totally unaware of it. So we need to have give a proper guidance, and all the details on the vocal hygiene has to be taken care of.
Yeah, nowadays actually the pyrotechnic methods are also used, no? Smoke, sudden, or
Yeah.
all those fire and all those also affect the performers actually. Uh, some are used to it, but some are with the smoke and all, they're finding it difficult to perform while on stage.
Somebody wants to know about the incidence of muscle tension dysphonia in cases with vocal nodule. I think it's admin boy, should be Rohan, I believe.
Yeah, exact percentage I cannot tell you now. I have to look at the studies, but in children it is, I mentioned 1% did it. Shah et al. He said 75% cases are associated with muscle tension dysphonia.
Actually, vocal nodule is a secondary change due to muscle tension dysphonia. It's considered as a type 1 muscle tension dysphonia itself. So it's something something related itself.
So you have Dr. Rashmi, you have mentioned about use of steroid in very emergency cases where you cannot avoid the performance.
Yeah.
Steroid in what form it's the best? Because if you take oral steroid also, it will take time. So what kind of steroid you will suggest in here?
It depends on when exactly the performance is. If we have a time gap of 1 or 2 days, oral steroid definitely would help. But otherwise, injectable, what is prescribed in Dr. Satlov's textbook is injectable steroids, methylprednisolone, and he has also described an intralaryngeal injection, but I have no experience on that. Topical injection has also been described, but injectable for acute cases would be preferred. And if we have at least 48 hours, oral steroids would also definitely help.
Any role of nebulization? If it's
Nebulization
nebulization,
of
because
steroid,
yes,
maybe,
because
but
it
I have.
worked for me because no, in one emergency situation it had happened in our college days because like during practice session teaching my colleague means friends know they are not trained at all. By the time the day of performance my voice is like it is nothing was coming out.
Oh.
So I took the inhaler, then it during the performance voice was perfect, then after that again it came to zero. So I think in emergency situation actually it worked for me, so that's what actually I wanted to share.
Maybe topical effect would be definitely there. Along with it, there would be a humidification too. That would also help. So
Yes, yes.
definitely, yes.
Yeah. I think, Anjana, we have run out of questions, or if there are any comments from anybody, I think we can take it, or otherwise I can ask the presenter and the expert can give some final sort of take-home messages for the audience, for the youngsters in the group regarding management of vocal nodules.
For me, the number one part is to not to jump to surgery, because still now we have seen people advising surgery sometimes, and so we should always give it a try with voice therapy and counseling and vocal hygiene explanation, trying to understand the patient's lifestyle. So first thing I stress on that, and proper diagnosis. Just any swelling in the vocal cord is not a nodule. So a cyst is commonly misdiagnosed, most misdiagnosed as the nodule. So that should be differentiated because treatment protocol for both is totally different.
And from my side, most important is take a bit when the patient enters the OPD and give you the symptom, then itself have an evaluation on their speaking technique, to take time on their techniques, so that would give us an answer for the treatment part as well as the diagnosis, because a proper voice evaluation answers majority of our helps in the diagnosis of majority of our majority of the voice issues. So take your time and evaluate the patient, and then only jump into the investigations as well as the treatment part.
I think one question is often asked in discussions on voice. I think I'll ask that question again on behalf of the audience. How useful is stroboscopy in the diagnosis and management of vocal nodules? Can you just manage it with a telescope, or do you really need a stroboscope for managing?
Shall I take it?
Yeah, please.
If it's a vocal nodule, we don't require a stroboscopy in majority of the cases. But if it is a persistent one, we are giving therapy, but the patient is not responding, then we have to think of something else. It could be a cyst2 and a contact lesion there. Then stroboscopy would help, and a flexible with a stroboscope would help to evaluate for the other muscle tension too. Because when you do the rigid scopy, the tongue is pulled out, the supraglottic compression would be taken away because of the pulling out of the tongue. So the exact technique what the patient is using when he speaks, we can clearly identify only with flexible scoping.
Right.
Deepika, anything to add?
No, in my experience, I have seen very early nodules are picked up with the stroke rather than only rigid laryngoscopy. And the prominent nodules, so we can see with the laryngoscopy only.
I think we have come to the end of the discussion, and it's 8:57 according to my watch, and our time ends at 9. So thank you, Dr. Reshmi, for coming over and interacting with us and sharing your knowledge. And Dr. Devika, everybody has congratulated you for a nice presentation.
Thank you. Thank
Congratulations.
you for the opportunity. I want to thank Khanna ma'am, Anjana Baido, Anjana, and everyone at Navoy organizing this. Thank you so much.
Thank you, Dr. Rashmi, for your presence, your
Yeah,
inputs into
thanks
the
to Dr.
subject.
Rashmi also.
And also Dr. Devika for your wonderful presentation, and Dr. Gautam for your presence and moderating the session. And I thank all the members present here in this Neboy classroom. With this, we conclude our today's classroom here. Dr. Rohan, can you stop live streaming?